Hi, everyone. Good morning. Today, we're joined by Dr. Petronella Adomako, an infectious disease physician for McCady Hospital here at Intermountain Healthcare, to give our COVID-19 update for the community. Thank you so much for joining us. It's nice to see you.
Same here. Thank you for having me.
Of course, and I like the red. Today is Wear Red Day, so we're both wearing red in honor of that. It was not planned, but it does coordinate very well. So as always with these conversations, I want to start out with case trends, what's been happening since the last time we spoke. Our case counts for the state of Utah are at a total of 351,273. Yesterday's daily case count was 1,273, which brings our positive 7-day rate to 16.5%. Our hospitalizations total is at 13,697, with yesterday's daily hospital count at 365, and our ICU referral rate at 78.3%. We have a total of 1,711 deaths in the state, with 14 reported yesterday, and 3 of those did happen prior to January 14th. We've also given out 362,701 vaccines, which is more than our total case counts in the state, which is awesome. I want to start from your perspective on how your team is doing. How is the vibe and the atmosphere like at McCady Hospital, especially dealing with COVID for about a year now?
I like the word team, because that's what we've been seeing, a team effort actually. So obviously at the beginning we were seeing cases and we're kind of hoping that we are not going to see the surge, but we as a team, the McCady Hospital, the administration, the healthcare workers, the support staff, everybody has stepped up from the beginning, come up with ideas to support each other. We had lower numbers compared to the rest of the system in the beginning, so it seemed as if we thought we could probably have had it under control, but clearly we see that that was not what happened. But as mentioned, it's been a team effort. As tiring as it has been for the providers, we have seen everyone step up. We have seen people willing to work extra shifts. We have seen providers who work in the outpatient setting coming in to help take care of inpatients. And it has been tiring. I would not say that we've lost personnel, but it has been tiring. It has worn on people, but we have seen the good results as well. We have seen patients recovering, and then you see the joy that the team has when a patient recovers and leaves the hospital. Of course, when we see the deaths, it saddens us as well. I mean, we had significant mortality, and we clearly don't want to see that. But we are hoping that now that we have the vaccine, there's a light at the end of the tunnel. So, and I'll say it appears as if our numbers are going down. So maybe we are getting there, or we're getting close to the light.
You bring up the point I talked about, how the vaccine number is now higher than our case counts. Is there something that the community can infer from that? Is it a positive piece that we're kind of moving in this correct direction? You mentioned the light at the end of the tunnel. So what can the community infer from the fact that so many people have now been given the vaccine?
It's a good thing. I would not say we have all completed our courses of the vaccine, though. I mean, not everybody has completed the full series, but it's good that we have a significant number of people who have been given the vaccine. So we are hoping that the vaccine hesitancy that we have read about is going to decrease. But I think that our numbers have gone down because, that's my thought, I would hope that people are taking it more serious, and we are practicing social distancing, wearing the mask, hand hygiene, do what we're supposed to do, trying to avoid large gatherings. So I would hope that that's what's been contributing to the decreased numbers. I am not sure that at this point in time, we can say that the vaccine has contributed to the decreased numbers.
And I think it's also important you bring up the public health measures, that people still remember that even if you've gotten the vaccine, whether it's the first dose or the second dose, that you have to still practice social distancing, wear your mask, wash your hands, it doesn't automatically make you available to go back into the world like you were a year ago. And I think that's really important to remember, because it is a light at the end of the tunnel, but it's not the end yet. We're not quite there, especially with the new variants, which is kind of my next questions around that. So we've had a couple variants from the UK, South Africa, and Brazil start appearing more in the US. Is this a concern for the community at all? And do we need to change our behaviors because of these new variants?
When you say change behaviors, you mean we should have mask up more? That's what I'll say. But yeah, the variant is we're still dealing with the coronavirus, and we're still learning more about these variants. It appears that some of the variants may be easily transmissible. And there's a report from UK that it appears that the UK variant may be a little bit more deadly, but then again, we need a little bit more information. So at the end of the day, I think we should just bear in mind that we're dealing with coronavirus, SARS-CoV-2, which is easily transmissible. It can cause severe disease. We know there are some predisposing factors that lead to severe disease, but there is still the uncertainty associated with this infection. So ultimately, what we need to continue doing is still practicing the public health measures. Again, social distancing, masking up, hand hygiene, and when it's your turn to get the vaccine, you get it.
I want to go back to case counts really quickly and just talk about that downward trend that we seem to be having. Our hospitalizations have gone down, I think, around 100 people since Monday when I was speaking with Dr. Senyam. And our case counts have gone down as well. What is the one thing that the community can kind of take from that? If they're looking at these pieces of data, what's the most important thing that they should kind of infer from the fact that it is going down?
I would say the hospitalizations would be a reflection of the number of positive cases that we have, a percentage of the positive cases that we have. And we see that our numbers are going down. I believe at a point in time, we had a positivity rate of about 33%, and we're down to 16%. So I think that's what we see in the reflection. We are doing the best that we can when it comes to care of the patients. But basically, in terms of management, what we have what we have available are basically the same things that we're using, though there is a relatively new medication, the monoclonal antibodies that is being offered to patients on outpatient basis. And we are hoping that that decreases the numbers of admissions as well.
A question for you. This weekend is Super Bowl weekend, and someone wanted to know your opinion on the event from your perspective of having people actually attend the Super Bowl. Is there any sort of concern for having a large gathering of people there? I know that I think you're required to be vaccinated. Don't quote me on that when you attend. But it is one of like the first big events that have happened, at least in the US in the last year. Do you have any concerns at all from this from a personal perspective?
Well, there's always a concern when you have a large gathering of people. And we would hope that the necessary precautions are being taken. I'm kind of assuming here that you're dealing with a large stadium, so they're going to space them out, and they're going to make them wear the masks, practice hand hygiene, practice social distancing. So I am hoping that they've taken the necessary precautions. If I'm not mistaken, I think they have healthcare providers as their guests as well. And hopefully a fair number of them, if not all of them, have been vaccinated. So as concerning as it may be, I think they've taken the necessary precautions.
I think it's an interesting point too, that it's almost like a test in the water of what could be our next normal, as Dr. Shenyam put it last week. You're starting to see these people come back together with vaccinations or having more social distancing and stuff like that with a specific event, and it can allow people to see this light at the end of the tunnel from their perspective of this big event is happening. It's very important in US culture, the Super Bowl. So being able to have that type of event again, I think is kind of a silver lining for a lot of people. So, and yes, I do believe they're recognizing healthcare workers. So it'll be interesting to kind of see what happens. Another question we just got is, can you speak to how we should be celebrating this weekend? So if you're not actually physically going to the event, What are your recommendations for gatherings with people this weekend, specifically here in Utah?
Yeah, I don't think the message has changed, not yet. We still discouraging people from attending large gatherings. We would prefer that you stay at home with your nuclear family and watch the Super Bowl party, the Super Bowl game. Avoid Super Bowl parties. If you have to, they say you should be outside, but when I'm looking at it's snowing right now, I don't think anybody wants to be staying outside. So again, we are discouraging the large gatherings. We are discouraging the parties. Just watch it with your nuclear family.
Yes, and I think that's kind of been for every event or holiday that's happened since coronavirus has kind of become a thing is, yeah, sticking with your family, practicing good public health measures. And yeah, I'm looking out my window right now and it is snowing. It's supposed to snow all weekend, so outside might be a little bit cold for that. I want to switch topics to the vaccine. So we mentioned before that the state of Utah has given out 362,000 roughly vaccines in the last about month and a half. Why is it so important that those people who get the vaccine, say the first dose, still keep up with those public health measures? If you've got that 3-week period between those two doses, why is it so important that I keep making sure I'm staying safe?
So having the vaccine does not mean that you cannot get the virus. Basically, the way the vaccine works is that you are expected to be exposed to the virus. And once you're exposed to the virus, your body produces the antibodies to fight off the virus. So the fact that you have the vaccine does not mean that you may not carry the virus in your airways. And we do know that there's a lot of asymptomatic transmission. We do not know how long the virus, if you get it, hangs around for you to spread it. And so because we do not know that, we encourage people who have been vaccinated to still practice those public health measures.
And the state yesterday announced that hopefully they're hoping that the general public has access to the vaccine by early May, which is awesome news here in Utah. What do you feel like getting the vaccine means to the general public, or even you, if you did get the vaccine? And you don't have to say if you did or not, but what does it mean for you or your team to be able to access this piece of science that we've been waiting for?
Oh, I did get the vaccine and it was awesome. Well, I should say it. The first dose was great. The second dose, a little bit, but at the end of the day, I'm glad I got it because it's something new, I believe. And we know from the studies that it's 95% effective. It's not 100%, right? So even though we are hoping that everyone would get it, we do suspect that clearly not everyone is going to get it. We know that for us to achieve herd immunity, where you have a large percentage of the population having antibodies to it and thereby decreasing the chances of a transmission, we have to vaccinate, you have to have about 75, 80%. So since we are not sure that we have those numbers, much as we are looking forward to more people being vaccinated, we're still kind of encouraging people that just practice again. I can't say that oftentimes, but just continue practicing the public health measures. Hopefully, once we get the vaccine, we would see our numbers go down and we may be able to gather together. I don't think that we're going to be in this situation for the rest of our lives. I'm hoping that by fall, we should be able to hang out with family. We should be able to hug each other, and getting more people vaccinated would help us achieve that goal.
Another question I have is around comorbidities. The state also mentioned yesterday that 65 and older and people with specific comorbidities can start signing up to get the vaccine on March 1st. Why is it important for someone who has a pre-existing condition or a comorbidity to get the vaccine for themselves? And is it safe for them to get that vaccine?
So what we have seen in cases is that a fair number of individuals who develop severe cases do have certain comorbidities. And some of these comorbidities are heart disease, diabetes mellitus. They are immunosuppressed. That is, their body's ability to deal with infections is much lower than the someone who's not immunosuppressed. Then we certainly see it more in minorities as well, so as well as lung diseases. So based on that, knowing that we tend to see severe cases in individuals with these morbidities, it makes more sense to try and vaccinate those individuals first, thereby decreasing the chances of them developing severe disease. What was the second question again?
Is it safe for them as well? I know a lot of people are concerned that because they have a comorbidity, the vaccine might not be as safe for them, but I'm assuming that it is, and the data kind of suggests that. Is that correct?
Yes, it is safe for them. But I'm sure Eddie has said this over and over again. The vaccine is just coding for just one part of the virus. So once you get a vaccine, you are not going to get infected. You are just basically developing antibodies to that part of the virus. So, and most of the studies that have been done, a few were done in immunosuppressed individuals and they appear to do fine. So yes, we do encourage people who have certain comorbidities to go ahead and get the vaccine.
A question for you. In the last year, what is the biggest lesson that you've learned over this pandemic? What is something that when you look back at your time during this pandemic, you'll kind of remember and think back about learning during this crazy time?
What have I learned? I learned that the viruses are much smarter than we are. Okay. What I think has amazed me the most, for me, aside from what I see in the hospital, the compassion, healthcare providers, the compassion that healthcare providers have for each other, for their patients, and the support system that I've seen. But what I think I've enjoyed seeing the most is how fast we got the vaccine. This is a completely new way of coming up with producing antibodies, getting the body to produce antibodies. And I think it's such an awesome mechanism that I could not wait to get my vaccine. And I think that's what stuck out to me the most. I mean, we've seen the morbidities, we've seen the mortalities, but we've had stories of heroism. We've had stories of patients trying to make a difference, even when they are the ones who are suffering, they're still trying to make a difference in patients' lives. And that's, in the healthcare workers' lives. So those are all good things to see, and I've enjoyed seeing them. I guess I've taken them for granted now because I've seen so many of that. But for me, it's the vaccine development. I think it was awesome.
That's great to hear. And I agree. I think it's so amazing what science can do. And I know that this mRNA specific vaccine has been studied for a really long time. It just hadn't really made it to mainstream science or the public until this year. So it's really interesting to kind of see the data on this vaccine and the mRNA and kind of what that means for the community and science going forward. Could this potentially help us with other vaccines as other viruses potentially happen? I had a question around the Johnson & Johnson vaccine too. Do you know by chance if there's any indication on this vaccine getting approved for the US? I know that the last time I spoke with Dr. Senyam, it was still, they had just released a report about the efficacy of it, and it was around 72% in the US for that one dose. Do we have any further information around when it's actually going to be approved to be used?
So I think I saw in the news yesterday that they were going to submit the EUA to the FDA, and the FDA is going to look at it as quickly as possible. So I hope that within the next couple of weeks, they are going to review it, and we should have that. I believe we should have that approved, but we wait for the FDA.
And as far as Utah getting it, I know that kind of all depends on the federal level and how much vaccine is available and working through with the state. So we'll definitely keep people in the loop as new vaccines become available and what that timeline is for distribution, because that could definitely speed up how fast we get to vaccinate people as well. So Dr. Adomako, is there anything else you'd like to mention to us today around COVID-19 and what your experience has been during this pandemic?
What can I say? I mean, we've clearly learned so much as we've gone since the beginning of the pandemic. Initially, we thought there was not a lot of human-to-human transmission. Then we realized that there was a lot of human-to-human transmission. Then we realized it was easier for it to spread. Then we came up with different treatment modalities, and we're still learning as we go along. But what I have liked, or what I have learned is, despite the difficulties we've had dealing with a new virus, I have seen healthcare providers trying to make as much difference as they can with sometimes the limited resources that they have. I know in the beginning it was kind of difficult to watch patients die when you didn't really know what to do for them. But despite that, they have persevered, they work their butts off, and that makes me happy that I'm a healthcare provider. Can I say that? I mean, people sometimes ask me that, yeah, you must be very busy, but I do not think I'm as busy as those on the front line. And when I say front line, I'm talking about the nurses, the emergency room physicians, those who sit at the stations checking patients in, the environmental staff who are cleaning patients' rooms. I see the joy, difficult though it has been for them, I see that they have persevered, knowing that hopefully there's a light at the end of the tunnel. So I'll just say thank you to all of them.
Last question for you. What message do you have for people who are experiencing COVID fatigue? It's been a year. It's been very difficult for people for all sorts of different reasons, but what kind of message do you have for those people who are very tapped out of this pandemic?
Yeah, I think I'm tapped out myself as well.
I understand.
It's been long, it's been difficult, but I do not think we should give up at this time, because when we give up, the cycle we just kind of go back multiple steps. So difficult though it has been, I think we should kind of say that we have, if you're running a 400-yard race, maybe we've done 100 yards. So we have 300 more yards to go. They should hang in there, continue. They should not stop those public health measures. They should continue that. They should educate themselves. And the CDC is an awesome website for information. Utah coronavirus website is also an awesome site for education. Educate themselves, know what they have to do. And when the vaccine comes out, I would encourage them to get it.
I love that metaphor of the race. I think that's awesome. And it speaks to a lot of people. Thank you so much for joining us today and giving us your perspective on what's been happening for the last year. And if anyone watching has any questions around COVID-19 and would like to get tested or find out more information about the vaccine, for testing, you can visit intermountain.com/COVID testing. You can fill out a quick survey to see if you qualify for a test, which will then allow you to schedule an appointment arrival time at one of our facilities. For the vaccine, you can just Google Intermountain COVID vaccine and our website should pop up, or there is the state resource at coronavirus.utah.gov/vaccine. We also still have our emotional health relief hotline available 7 days a week from 10 a.m. to 10 p.m. It's a great free resource for the community if you're looking for any type of additional support. That phone number is 833-442-2211. Thank you so much again for joining us, and we'll talk to you later.
Okay. Thank you.